I'm going to turn it over to Dr. Dougall. Jen? For the
Okay.
didactic.
Yes. So today I'm preparing a brief didactic on self-care for the caregiver. There may be some things that I will not get to because I want to leave room for the case presentations. But rest assured that any resources that I may blow through very quickly will be available to you through the presentation that I'm providing today. So those should be coming out your way, I believe. So with that being said, let me share my screen here. Are we good there, everybody?
You might want to put it on presentation style.
Yes.
Okay.
I just need to move. Here we go.
There it is.
Do. All right. All right, and this is where I do the juggle with you guys. I'm trying to find the best place to locate you in case something comes up. Okay, so like I said, we're going to fly through some things, but I think today, the primary focus for this brief didactic is really identifying burnout and compassion fatigue symptoms for caregivers, and identify some basic self-care principles that will help someone in caregiving role to improve their situation. It's already stressful as it is. You can't always remove that stress, considering the circumstances, but there's ways in which it can be improved. So that's my goal for today. Okay, so today we're gonna unpack stress and burnout a little bit, okay? First of all, what I want to take a look at is just looking at two different angles of when we talk about chronic stress and burnout. Okay, so chronic stress is emotional pressure suffered over a prolonged period of time. It's a perception that one has little or no control over their circumstances, and it can have a very long-term impact on the body. Burnout is when chronic stress persists. So it's going even longer than the longer, right? And without any alleviation or any adaptation made by the person or the circumstances. It leads to emotional exhaustion, depersonalization, which is that sense or feeling like you're here, but you're not here. Your body's here, but your mind isn't. You're separated. Feelings of apathy, like I just can't even, right now, I can't feel those feelings because I'm done. And feelings of inefficacy, that no matter what I do, it's not really making a difference. So it's literally, like a light bulb going out. Okay, so that's one layer to things. So then we want to take a look specifically at caregiver burnout. And studies have shown that more than 60% of caregivers experience symptoms of burnout. So what are those signs and symptoms specific to caregivers? So some of these things you may see in many other kinds and forms of disciplines, because this is what we look at when we look at depression or anxiety developing over a long period of time. So feeling overwhelmed or constantly worried, losing interest in activities that you used to enjoy, feeling sad, having frequent headaches or body pain or other physical problems, abusing drugs or alcohol, including prescription medications, identifying emotional and physical exhaustion, tending to withdraw from others, family and loved ones, having a loss of interest in things that you normally like to do, feelings of hopelessness and helplessness, changes in your appetite, either weight gain or decreased eating, feeling tired or often having changes in sleep patterns, unable to concentrate, getting sick more often, and having irritability, frustration, or anger towards others. This is quite the laundry list of things. It doesn't mean you have to have all of those to meet that criterion, but this is really certainly the symptoms that can happen to a caregiver. Just from personal experience, you see those things happen. My stepmother was taking care of my father in his last days from the deterioration from Parkinson's disease. And there were a lot of key hits that we had in those areas that were very, concerning because she was giving her all and wanted to provide the best kind of care for my father, but it was very much at her own physical and mental and emotional health. And it was something that was witnessed by the hospice care workers, but it was a situation where she didn't want to take advantage of the respite care. So we'll get to that a little bit later because I will use that as a little bit of an example, and maybe that might come up in other discussions. So that's what it looks like. But what it feels like to the caregiver is it can feel like anxiety or chronic fear, right? Because you don't know what the circumstances can be, and you may know what they are, and you don't want to acknowledge that. There could be anger or frustration that they're in that position, or that resources aren't being provided well enough for their loved one. There could be denial. Denial that no, this is what I do. This is family. This is what these are my marching orders. This is how I'm going to do it. And they would do it for me, so I'm going to do it for them, but not really attending to the consequences of that chronic providing of care. It could feel like guilt, like if I don't do this, then I'm letting my loved one down, or I'm hurting them in some way and not giving them the best quality care that they deserve. There could be, increased negativity, things just aren't working right, or feeling very secluded or alone. All right. So what are the causes? So, and what I mean by that, oops, let's go back in here. Why would we look at causes for caregiver burnout? I think logistically, most people are like, duh, like I'm putting my all into caring for someone and it's a lot of work. This wasn't my, many people, it's not their first choice of profession, right? And all of a sudden they're taking on their job and the secondary job of taking care of their loved one. But what we're really looking at is that we can't extract the responsibility that comes with caregiving. It is something that you sign up for if you choose to do so, and there's a lot of weight that comes with that. However, what can really cause the burnout factor with it is if there is some sort of role confusion. So let's say, for example, someone's working with their loved one and there's a hospice team. There's nurses coming in and taking care of everything. But the loved one is doing a lot more in the things, that you're doing more things in the situation than what you are, instead of deferring out to maybe the professionals that are coming in. And it may be because your loved one has said, oh, I don't like it when they do this, or, and so stepping into that. But what it can really take on is a multiple, like wearing of many hats. And it can really cause a lot of confusion unless you delineate that. Same with family members and other family members and their involvement in things. Splitting the tasks up. If one person feels like everything falls on them, then they're going to feel that burden. When maybe there are other family members that, even though they may be further away, they're willing to make that concession to make the distance to cover a weekend or what have you. But if they're not asked, they would know. So there's role confusion. There's varied expectations, right? How much do I need to put into this? How much, again, that difference between medical care and yourself, what level of expectations you're putting on yourself, and the care of your loved one. The feeling of lack of control, right? Especially if there's a, deterioration of the illness, and feeling like these factors I can't control. It's just only going to get worse, and there's no other circumstances, no other resources available to help me. So feeling left out in the world without any support, that sense of feeling. Too many responsibilities. So some people trying to take care of their loved one and do a full-time job or any kind of job or other tasks, or taking care of their other family members. And then simply just not recognizing the symptoms of burnout. And, you know, there is some form of body protection that goes into place, and psychological protection when you get overloaded, but sometimes you may hit that point and not even realize it. So, you know, where an apathetic response might be is just like you're frozen and you're just kind of giving one-word answers, or you may seem cold or distant, and that may not be your normal personality style. You may not know that you're affecting people in that way, but others may see that. So you may not recognize where those symptoms may be impacting. Okay. So where this can lead is kind of going into the next tier, right? Is a condition that is beyond burnout if you're not attending to these things. And this is called compassion fatigue. Okay, this is something we've talked about with first responders, but it's also relevant to caregivers, which describes a stage of extreme tension and stress. Unlike burnout, compassion fatigue is secondary stress disorder. It's caused by overexposure to the traumatic experiences of the person they're acting as a caregiver for. So just inundation, maybe bad news, bad medical news that comes down the pipeline. You know, and the waning or lack of empathy associated with compassion fatigue comes from the slow burn of taking on the emotions of those you care for. It makes it difficult to be compassionate. So you can kind of get frozen, right? You could start out as that very vigilant caregiver doing the best that you can, but if you're not attending to yourself, it could lead to this point of great concern, which is compassion fatigue. And, you know, in the occupational world, that is a concern. It could be an occupational hazard, but it can also, even if it is not your primary occupation to take care of your loved one, they're not going to receive as much, the best care possible if you're taking too much on you as a caregiver. So some of the phases of compassion fatigue that tend to happen are the zealot phase. As I mentioned, you're kind of gung-ho, I'm going to do this, you know, I love them and give them the best care. Then you could withdraw from others around you and the supports that you have. And then you may feel like there's no one else out there to help me because I feel like a burden to everyone, and you make it irritable. And then you get into that kind of zombie phase, right? Where you don't feel the emotions and you become apathetic. So those are some stages to think about, you know, and to attend to as we go along. So what can we do, right? So really briefly, we're going to run through these because, again, I want to make sure that there's enough time here. So first of all, there's basic self-care techniques that you can do. But specific to caregivers, I think that some key considerations that are important are, first, a willingness to accept help. And I have seen this with multiple family members, caring for other family members, and there's sometimes a resistance to do so. They don't know, you know, my loved one doesn't like how they do this, so they you know, they don't like how they dress me, they take care of me, it's just not, it's stressful, so therefore I'm just going to take over, right? People are willing to help, but the thing is that the more you turn away help, then people are going to respect that boundary because they've already asked and put that out there, and they're going to stop offering. So when you get to that critical point where you are feeling compassion fatigue, all of a sudden people aren't going to be stepping in because they've probably already tried and they've got maybe fired from their position, or, you know, just not asked to help. So it's learning to accept help even when it may not be perfect, or 100% the way you may like it. You know, you have to, everybody's working with what they have as far as their amount of emotion. And you have to really consider that we're not going for perfection here. we have to do the best that we can with the resources that we do have, minus anything egregious, So setting realistic goals. I've also seen with a dear friend of mine the deterioration of working full time and taking their loved one into their household and taking care of them, never feeling they have an opportunity to leave the house, to go do a weekend adventure or a week or use respite care. And, those goals aren't realistic when you don't allow room for your self-care in the process. You have to allot time to do the things that you have for your loved one, but also allot time for your self-care. Ways in which you can kind of learn where that balance is without feeling guilty is joining a support group. Joining a support group of other caregivers can be really helpful because it will normalize the experience. You're going to be talking with other people feeling the same thing that you are, whereas maybe other friends or family members may not understand. And you can get good tips and maybe feel like you have permission to take a step away and take a week trip away and use respite care or a weekend day or a day or something like that, starting out small. The support group can be immensely helpful. Paying attention to your own health needs and putting those as priority, because if you're not taking care of your health, then you're not going to be able to take care of your loved one's good health. And also connecting with a mental health counselor can be very helpful for those tough circumstances. Some people find themselves in, it's like, okay, Jen, I hear you, but there is no way any other member of my family is going to help because it's just not that kind of family. And people said, I'm not going to do it. I just hire somebody to do it. And so you may feel really alone in that endeavor, and those resources may not be as available to you. So talking with a mental health professional can help you learn to set those boundaries, kind of speak up and be assertive when you need to determine what needs to be done with other family members who may be not taking on responsibilities when they could be, or dealing with family members who are not, and moving on and starting to cut out a plan. So getting help from another perspective and working with a mental health professional can be very helpful. Okay, so these other things things to consider, these are going to be in your slides, of just basic self-care things: eating right, exercising, practicing some good mindfulness-based practices like deep breathing, meditation, muscle relaxation, all of those things, and taking good care of your health. Those things all can give you, even if just in little bits, right, can be better than nothing at all. Those other things like grounding techniques and things you can find in some resources that I'll point to at the end. How we react, changing how you look at your circumstances, looking at, I'm grateful to take care of my loved one, but I may have to step back in my expectations for myself and what I expect, that I can do up to this level and not this level. And changing kind of how you look at the circumstances. We're looking at the best care that we can do, not perfection. And knowing that, just taking into all the factors and receiving support and working as a team and going through those things. This is how you can change how you react to a situation, and it can begin to soften the blow of the responsibility that you have. The other thing is how you relate. And again, this goes back to where my initial suggestion is to seek help in support groups. Learning how you relate to other people, that community with others who are going through similar things, so talking with other caregivers can really give you a sense of feeling understood. You may not change the circumstances, but you will have a place to voice your feelings that you may not feel comfortable sharing with others, because sometimes you might feel like you feel guilty for feeling the way you do. So again, it's changing how you relate to people and not keeping people blocked out of your life, but allowing them into your life with healthy boundaries in place. And lastly, changing how you think. Rethinking stress. In these kinds of situations, the stress is realistic. There's just extra tasks that you have to do. Getting care for your loved one is an extra thing that you've committed to in doing the help that you need. But it's taking stock of, and I don't have time to go into this, but I just included it in case you're interested. But there is a wonderful TED Talk from a professor, Kelly McGonigal, who did research on how you look at stress. And if we look at it, it's always stressful, but there's also ways in which you can look at good stress, right? I can reframe this instead of like being with my loved one who's passing away, and this is really sad and very hard. Yes, those things are true, but you could reframe it in another way. I get to spend these last treasured moments with my loved one. And so even though it's hard, this is a treasured moment and it will not last forever. So changing those mindset adjustments. And some of that is just working on learning how to understand your thoughts and feelings, and mastering controlled empathy and working with the counselor to kind of identify those harder things and getting flexible with your time. So I think I am going to step back from there. I have resources available, some self-care links that are available to you that are on my handouts that you can take a look at. These things have mindfulness-based practices in them. There's also some apps like deep breathing exercises, guided meditations that I have found useful for the people that I've worked with. I also found some links for caregivers that can be very helpful. And one thing I'm kicking myself that I did not include is there's a wonderful resource I ran into when I was a first-time counselor called Faith in Action. And some communities have it and some communities don't. But it is a collective of churches in the area that have a list of volunteers that are willing to come and sit with a loved one, to drive them to a doctor's appointment, to do many of those things. There might be just resources and talking with like a area agency on aging, or other disability office to determine where other resources may come from. But these links could be very helpful in linking you up. And it's not just relevant to dealing with someone who may be elderly, but also individuals with disabilities. And if you're double timing and doing work, you might be able to sign up to become their primary caregiver and let go of your other job and then get paid to be the primary caregiver for your loved one. There's resources in talking about how to do that. I sit in on the autism panel at Neomed about, and there's a family that talked about how they had to make that choice, and it just brought all that pressure down. And since they were home anyway, they were getting paid to be their own loved one's care provider. So that's it. That's in a snap. So I'm going to leave some time now for some case discussions. But that is just a quick snapshot of some things to consider.